Hi guys, I'm Camden Doss, and today I'm going to show you how to do an IV catheter insertion. So the first thing you want to do is check your order accuracy. Then, once that's checked, we're going to do some hand hygiene and gather all of our supplies. So the first thing we've got here is our antiseptic swab to clean the site, our tourniquet, our IV catheter, and it's a 20 gauge. We know that because it's pink. And then we have our transparent dressing, our stat lock, our J-loop, our saline flush, and our 2x2 gauze. We'll go ahead and prep this. Right. Now, we're gonna identify our patient, so name and date of birth, provide them some privacy for the procedure, and then we're going to identify their non-dominant hand first. So we have a left arm here, starting at first we're going to occlude with a tourniquet. Starting from the hand to the upper forearm, to the upper arm, we're going to choose a vein. So we have chosen the cephalic vein here. Now we're going to don our gloves. Then we will prepare our site with an antiseptic. We want to make sure this fully dries. So now that it's dried, we're going to take our needle, our IV catheter, fully dried. We're going to provide some traction. Then we're going to insert the needle at a 15 to 30 degree angle with the bevel up. We've got a flash of blood, so now we're going to decrease to a 10 degree angle, insert just a little more, and then we will finish inserting our IV catheter to the hub of the skin all the way. Then we'll take the needle out. Flash the scene, occluding that so that there's no overflow all the way. And then we're going to take the tourniquet off. We'll connect our J loop to the IV site. Then we'll clean any extra blood from the site. Then we'll apply our stat lock. So now that's secured. Then we'll have our transparent dressing, and we're going to need to initial this and time and date it so that they know it was me. Then we're going to pull back to check for blood return. Then we'll flush to ensure patency, and we're going to want to chart the date and time of the IV insertion. We're going to want to chart the patency of the IV, the dressing used, the IV is leaking, and then we're going to want to note the patient's tolerance to the whole thing. And then the last thing we'll do is dispose of sharps in a sharps container and biohazards in a biohazard container.